Basic skin types and tips. Our skin plays a huge role in our appearance and self-confidence. While a majority of the world's population assumes that their skin falls within the category of normal, there are a few different types of skin, each necessitating some different skincare for best maintenance and upkeep. A popular way to determine your skin type is to remove your makeup and wash your face with a gentle face wash and pat it dry. Wait 1 to 2 hours for your skin to return to its natural state, and do the gentle tissue paper test, where you take a piece of soft tissue paper and dab it across your entire face, paying close attention to your T-zone. Normal skin is not oily, and it does not peel or flake either, but appears to be soft and smooth. Oily skin, when blotted with a tissue paper, will show greasy marks. Dry skin will usually show peeling, flaking, or tightness. Dry skin requires more frequent moisturizing. The most common skin type is combination skin, which presents with a greasy T-zone while the rest of the skin ranges from normal to dry. Skin is categorized into 5 basic types: normal, oily, dry, combination, sensitive. Microdermabrasion is beneficial when used only once a day regardless of skin type. Also, note, never exfoliate over existing dermatological disease like rosacea or eczema, normal skin. The least problematic of all skin types is normal. Normal skin requires the least amount of attention and care. Normal skin is healthy and radiant. The pores are usually small, while the complexion remains even and breakout-free. Normal skin is not known to flake nor become greasy in the course of the day. At midday, the normal skin usually still looks fresh and clean. Tips for normal skin: cleanse with warm water and super premium face wash twice a day. Wear sunscreen in the daytime if you are outside for more than an hour. Choose oil-free moisturizers for regular use and allow them 10 minutes to absorb before applying makeup. Avoid heavy makeup and use a mineral foundation. Remove makeup and cleanse your face as soon as you are home and in for the night. Do not wait for bedtime. Oily skin, characterized by excessive grease or oil, this skin can be difficult to control as compared to normal. While it feels nice and hydrated after washing, by midday, oily skin is usually slick and shiny, especially across the T-zone or the forehead, nose, and chin. The pores are often large, the texture can be generally coarser, and it is acne-prone. More common in young people, oily skin is exacerbated by hormones, heat and humidity, and even psychological stresses. Tips for oily skin: use oil-free, non-comedogenic face products. Use warm water with super premium face wash for cleansing. Use only mineral-based makeup products. Use a light application of acne product with benzoyl peroxide twice a day after washing. Do not overwash or over-exfoliate your face. Washing your face gently 2 or 3 times a day is far better for the skin than overly aggressive washing. Experiment with both alcohol and alcohol-free toners and select the one best suited to your needs. Use blotting paper during the day if you cannot wash because of your work schedule. Dry skin. Often associated with a dull complexion, dry skin feels taut, can be flaky, and is significantly prone to early aging, fine lines, red patches, itchiness, cracking, peeling, or wrinkles. This skin type almost always feels dehydrated and requires plenty of moisturizing. It rarely, if ever, gets greasy or suffers breakouts. The pores are tiny and the texture can be papery and thin. After washing, dry skin feels tight, like a mask, which is too small for the face. By midday, dry, flaky patches may form. In people of color, dry skin often appears ashy or seems dull from a residual dead skin buildup. Tips for dry skin: look for skincare products with glycerin, shea butter, and hyaluronic acid. Avoid alcohol and gel-based products. Use a rich, creamy cleanser. Try using a cold cream on the face before wiping it away with cotton balls instead of rinsing with water. Always rinse the skin with cool water after cleansing. Use night creams during the day that provide longer-term moisturizing. Combination skin. The most common of all skin types is combination skin, which combines and exhibits some features of normal, oily, and dry skin types. Generally due to a genetic predisposition or hormonal imbalance, combination skin usually features an oily T-zone, the forehead, nose, chin, and the area above the mouth. Often there are dry, flaky cheeks. The pores tend to be medium-sized, while the texture is usually even and smooth. After washing, the oily areas feel nice and refreshed, while the dry ones feel taut and stretched. By midday, the T-zone is considerably oily, with grease coming off on a tissue paper. The oily parts are also known to be acne-prone if the acne is severe. It is recommended that you consult your dermatologist. Tips for combination skin. It is advisable to treat different areas of the skin differently. Use 2 different cleansers, a super premium one for the oily T-zone, while a milder one should be used for the cheeks and neck. Use an astringent for the oily T-zone areas and a mild freshener for the dry areas. Treat the eye areas with rich creams and moisturizers. Allow 10 minutes for them to absorb before applying makeup. Matte mineral makeup and foundations are best for oily skin. Sensitive or extra sensitive skin. Sensitive skin can be in combination with any of the above-mentioned skin types, making it the most difficult to control. Sensitive or extra sensitive skin tends to be delicate and thin, with fine pores, and is easily irritated. It tends to adversely react to many common medications, laundry detergents, skincare products, foods, fabrics, and even pollen allergens. It can easily become flushed red because it is prone to broken capillaries. It can burn, itch, be inflamed, and or even become excessively dry. After washing, sensitive skin might feel dry, burning, or even take on a rash-like appearance. By midday, it can flake and even have some redness. Tips for sensitive skin. If you have sensitive or extra sensitive skin, you should definitely be seeing a dermatologist. Use only mineral-based makeup products. Use only fragrance-free, hypoallergenic, and allergy-tested skincare products. Spot test any new skincare product or makeup behind the ear for a minimum of 3 nights before using on your face. Repeating this warning, never exfoliate over existing dermatological disease like rosacea or eczema. Not all skincare products are successful for all skin types. Regardless of the type of skin and your level of sensitivity, high-quality microdermabrasion performed once in a day, right at home in your shower, is the highly effective skincare maintenance treatment for age spots, skin discolorations, wrinkles, and even acne. Once daily microdermabrasion is a quick and easy fix for most people.